Hi guys, how are you doing? My name is Mimi. If you are new here, welcome to my page. I know it has been such a hot minute since I last made a video, but I definitely wanted to end this year strong. So if you're new here, just stick around, smash the like button, comment below your favorite part about this video, or maybe some of the nursing content that you guys would want me to talk about. So grab your cup of coffee and we're just gonna go ahead and get into today's content, okay? So today's video, I'm just going to go ahead and cover a little bit about some of the things that I feel like are very important to know, but they're not necessarily covered in nursing school. So we're just gonna go ahead and dig a little bit deeper in some of those things that I feel like are very necessary for you guys to know, so you'll be able to be successful in your nursing careers, okay? So the first thing that I did want to talk about is how to manage your money, right? If you are not new here, you've seen some of my previous videos, you know I love to talk about money. Your girl loves to talk about money. So, you know, I know sometimes it could be such a little bit of a topic that we don't talk about, but you know, we all need to learn, and especially if you're a new professional, about how to, you know, get the most out of the money that you're able to make when you do start your nursing job, and how to, you know, guard, you know, the salary that you guys are making as well and make it work for you. So one of the things that I would say is definitely do pay attention to your orientation. Do understand when they talk about your 403Bs or your 401k. Those are all avenues for, you know, saving for retirement. So definitely pay attention to that and understand what is the matching for your, you know, for your institution, how much they will match you and how many years that will be, because that will give you a guideline about, you know, how long you would want to stay in, you know, in that hospital setting, or maybe it will push you to really find a place where you feel like you could stay a little bit more of a long term, because you really want to take benefits of those matching and, you know, really having that extra income for your retirement. So definitely pay attention to that and learn as much as you can, and definitely make sure that you're taking advantage, because a lot of the places where you work, they probably will do like a 2% match with whatever that you're matching, a 3% match. And if you're not, you know, increasing your match or doing anything like that, they kind of keep you at a very, very low matching rate. Sometimes it's like 1%, 2%. So definitely make sure that you guys are taking advantage of maybe like the maximum amount that you are able to get matched, because it is free money, you know, especially if you are, you know, a younger person, you're starting your career when you're in your 20s. So, you know, you don't have as much responsibilities, maybe as someone with like a family. So definitely make sure that you are paying attention to all your benefits, and make sure that you're taking advantage of everything that you can at a very early stage of your career, okay? The second thing that I would say that, you know, can be very useful that you don't necessarily learn when you're in nursing school is about different certifications, right? So certifications is not something that is really covered in nursing school, but it is definitely something that is out there depending on whatever nursing specialty that you go into. So an example of a nursing certification is medical surgical certification. We also have even orthopedic certification, trauma certification. You can even get, you know, bariatric certification if you work in a hospital where you see bariatric patients. You can even get, you know, CCRN, and I'll say progressive care nursing certification are two of the most common ones people seek out. So, you know, if you work in critical care, you seek for the CCRN, and if you do work more like on a step down unit, you can go for the progressive care nursing certifications. So just so you guys know, all of the certifications, they have, you know, their different websites that you can go to and look into. So you can look into that and kind of see the requirements. Some of them expect you to spend, you know, at least 2 years in your organization or in your specialty. And, you know, you have to have a certain amount of hours as a nurse. So definitely look into that and, you know, see which one interests you. And if you are seeking, you know, more knowledge and certification, definitely look into that and see what will benefit you in the specialty that you guys currently work in, okay? So if you want to ask, you know, why should I even look into getting a nursing certification? Well, different hospitals have different things that they'll be able to offer you when you do decide to seek that, you know, higher level. I would say for one, you know, if you're coming in, you've been a nurse for 2 years, there's just so much you can learn as a nurse. So really seeking that higher level of education, honestly, at the end of the day, it just really helps you to take better care of your patients. You feel more confident and you feel like you have a lot more to offer. And not only that too, but you're become like a much better resources for maybe newer nurses that are coming on, because you become a lot more knowledgeable, and it's also a lot more respected as well. Income wise, I would say some hospitals, they do, you know, give you an extra hourly rate just to get certification. Some do not. But if you work in a place that do not necessarily give you a higher pay just to seek certification, you can look into different things that they have, maybe like a clinical ladders, or when you can get like promotions within the hospital, and having your certifications give you a certain amount of points that really help you with your clinical ladder. And at the end of the day, you end up getting a little bit of a higher salary, which is a win for everybody. Okay. So the third thing that I would say that, is very valuable that you may not necessarily learn when you're in nursing school is definitely how to speak to the physicians, right? As a nurse educator, and I do see a lot of new nurses that are coming in because I work very closely with them, one of the things that I would say a lot of new nurses say they struggle with is definitely talking to the physicians, talking to the family members, and really giving and receiving report from each other at the beginning and also at the end of a shift. So those are things that, you don't necessarily learn. So definitely when you start your job, I would say, what I encourage my new nurses to do is really just take the time, role play with your preceptor. It is new to you. You don't always talk to physician when you are doing your clinicals, especially if you started in 2020. You probably did not have a lot of clinical experience with your, with the school that you went to. So definitely role play, look into that, have like a nice report sheet that I would say work really well for you. So look into one of those so you can maybe be able to organize all of the things that you want to say when you call a physician. I say organization is definitely key when you are calling a physician, and also when you're giving a report, because you want the information that you're giving to flow, and you want to be able to give accurate and important information, so they'll be able to give you the orders that you need. And not only that too, but you also set the other person that you're giving a report to success, because it is not always easy. So definitely make sure that you are organized. So if you do want some resources on how to organize yourself, and maybe like an example of a report sheet, let me know, comment below. I'll be more than happy to share those resources with you. And you'll be able to just master that skill. It's just another skills that when you practice, you'll be able to master. So definitely one thing to look into. Another thing that I would say is very important to know, but doesn't necessarily you learn it in nursing school, is how do you deal with difficult patients, difficult family members. Like, how do you deal with that? Even maybe like a difficult coworker, especially if this is like a new job for you guys. If you're, just now starting your profession, you're a brand new professional, or you never really dealt with any of those things before in the past because you probably didn't have as much experience. So it is something that's gonna happen, because in nursing, you deal with so many different people. You're working with so many different people and your interdisciplinary team members, like respiratory therapists. You have to collaborate with your speech therapist. There's just so many different people that you work with every day. And as much as I would love to say everyone is great and, you're going to get along with everybody, to be all honest, this is not always going to be the point. I mean, it's not always going to be the truth. So being able to deal with very different personalities is going to be very, it's definitely something you're going to encounter in nursing. And it's actually something that if you have nursing experience, and if you don't, one of the things that they always ask you in job interviews is how you deal with conflicts, because we want to know that you're going to be able to, deal with it in a manner that is, that is healthy. And we love to hear you go through the, the chain of commands, where you are able to address the situation with the person. Then you can go ahead, if that's not resolving, you can go to a clinical manager, which is like your charge nurses. And you can also go to like your nurse manager if the situation is definitely not handling, and then you go higher up. But we definitely want to see that you guys are taking the time to really deal with the with the situation with that person, just being able to talk it out. Sometimes a lot of the things that we deal with is probably just a miscommunication. So being able to sit down and talk through the situation can definitely be helpful. But, I always say if the situation is with a patient or with a family member, because they are very sick, they're not going to be in a good mood. So just being able to be understanding and empathetic about the situation that you're dealing with, even though maybe the things that they're saying are not facts, just being able to, to show that empathy. And I would say just being able to watch your nonverbal communication, just being able to sit down at like an eye level with that person, being able to, talk through their meds, like make sure that they're understanding everything that's going on with their treatment, giving realistic time frames too when you guys are going to be going into the room, because sometimes things do come up. So I always say just avoid saying I'm going to be here in 2 minutes, 3 minutes, especially if it's probably not going to be realistic, because patients, they do remember that. They're like, my nurse said they're gonna come in 2-3 minutes. Where are they? They're not there yet. So I would say just be very realistic and just try to give that time frame that you'll be able to come in, and just really making sure that when you are in that room to just try to address all the needs that you can at that one time, right? So I love you guys. If you have any more video ideas for me, just go ahead and put them in the comment section below. Just like I end every video, just reminding you that no matter what stage in your nursing career that you are in, whether you're a nursing student, whatever that it is, just keep going, because the world definitely needs the thing that you have, because you're the only person that could do it the way that you can, and we need that. All right, I love you guys. Bye.